If you're a parent with a child who's been diagnosed on the autism spectrum, you're likely looking for anything you can do to improve your child's quality of life. Without a doubt, somewhere in that journey, hyperbaric oxygen is going to present itself. And you might be wondering, is hyperbaric appropriate for my child? Is it going to be safe? Should I expect some benefits and changes in my child if I commit to some type of hyperbaric program? That's what we're going to cover in today's video. From traditional therapies like ABA therapy, along with non-traditional therapies like dietary changes and other modalities that might be used to improve a child's quality of life, the options for a child with autism seem to be endless. And where do I start? What do I use? How do I know if it's working? There are so many questions when it comes to a parent trying to figure out, how do I best support my child? My goal in today's video is just to walk through what hyperbaric oxygen is, what does it do, and why you might want to use it as part of a multi-therapeutic approach to regaining the highest level of function and the best quality of life that you can for your child. I'm Dr. Jason Saunders. I've been practicing hyperbaric medicine and functional medicine for over 20 years. We've treated thousands of kids who have been diagnosed on the autism spectrum, and we've had incredible results utilizing hyperbaric as part of this multi-therapeutic approach to improving a child's health. This isn't to say that other traditional therapies are not worthwhile, because they most certainly are. The traditional therapies, the ABA, the speech therapy, the occupational therapy, the physical therapy, these are all critically important part of a child's recovery. So many parents come to us frustrated because this isn't the only answer. They're doing all the speech, the OT, the PT, but their child seems to be plateauing at levels of function that are below what that parent really wants for their child. So as a result, they're looking for less traditional options, other therapies, other strategies, other modalities that can help their child continue to improve throughout their life. In our office, hyperbaric oxygen has been one of the most powerful therapies that we've used as part of that multi-therapeutic approach. Autism is a neurodevelopmental condition. It often shows up as delays in communication and language. Your child may struggle with social interaction or engagement. Often there are behavioral patterns that may be disruptive or even potentially dangerous for the child or caregivers around that child. We often also see dysfunction in how sensory information is being processed within that child's brain. Often these children also show up with delayed learning and a delayed timeline of when they're reaching certain developmental milestones. Today, some of the more forward-thinking pediatric functional medicine groups are starting to look at autism through a different lens, considering it more of an autoimmune encephalopathy rather than a genetic disorder. As we learn more about the autism spectrum, and as we view it through this autoimmune encephalopathy, the number of options that we actually have access to help families with children diagnosed on the spectrum begin to expand because of how many other therapies we know help manage the immune system and help manage the neurological system in a way to support it, heal it, and help get that child's health back on track. When I was a kid, the rates of autism were closer to 1 or 2 in 10,000. And now 1 in 31, or in New Jersey, 1 in 27 kids. How could we blame a condition whose incidence has skyrocketed over the last 40 or 50 years on something like our genes, which have barely changed in thousands of years? The only thing changing as rapidly as, let's say, the diagnosis in chronic conditions and developmental issues like autism is really our environment. If autism is in fact some type of autoimmune encephalopathy, well, that would make a lot of sense because we're also seeing incredibly high rates of other autoimmune related conditions, which also points more to environmental changes over genetic mutations. When a family first comes to our office, there's typically a number of different symptoms that they're really concerned about that they want to see shift. In the overwhelming majority of cases that come to our office, we have a child who's nonverbal, and seeing improvements in both expressive language as well as receptive language is one of the highest goals on that family's list. They often also want to see changes in their executive function, their behavioral patterns, and their patterns inside of social interactions. Their child might be having trouble relating to peers. They may have trouble taking directions in school or from their parents. They may have attention issues or planning issues that are decreasing that child's ability to perform at school or even inside of life's tasks. The important thing to recognize here is that no two presentations are ever the same. For as many children as we've treated diagnosed on the autism spectrum, there are an equal number of presentations. Every child is different, and every solution needs to be tailored to that child and that family's needs. As we evaluate what it might mean to have something like an autoimmune encephalopathy, we have to understand what would be at the root cause of a condition like that. Well, we would have to have immune system imbalances and high levels of inflammation and potentially chronic subacute infections. We'd also likely have some amount of mitochondrial dysfunction and an inability to really make the amount of ATP or cellular energy that a body requires to perform normally and to heal and adapt to a changing environment. We would also need to recognize that the brain, one of the most metabolically active tissues requiring the highest level of oxygen and energy in order to meet the demand, would likely be delayed if we had mitochondrial issues and chronic inflammation. As a result, we need to look for strategies that are going to help balance the immune system, improve neurological function, improve cellular energy production, as well as help regulate the immune system, regulate the neurological system, and regulate the hormonal systems. So how is it that hyperbaric may help these kids? For starters, we know that about 70 to 75% of kids diagnosed on the autism spectrum have hypoperfusion to the temporal lobe and the prefrontal cortex of the brain. The prefrontal cortex is associated with executive function and planning. The temporal lobes are associated with language, both expressive and receptive language. So if these areas of the brain are hypoperfused, meaning they're not getting enough blood flow, they're not getting enough oxygen, then how could we expect those areas of the brain to not be underdeveloped? The literature also shows us that most of these children have elevated levels of inflammation, often imbalances in their immune system, and subacute and chronic infections. And their defense mechanisms for managing some of those stressors, like their antioxidant systems, are also often underperforming. So yes, speech therapy, occupational therapy, physical therapy to improve their motor skills and their performance is important. But if they still have excessive levels of inflammation throughout their body and their brain, they're not getting enough oxygen to their system, and their body is still trying to catch up regulating hormonal systems and neurotransmitters, how could we really get the most out of speech or OT or PT therapy? We can't. So of course, we see these plateaus in performance on those areas. Well, even before there was research on hyperbaric and autism, we know that hyperbaric has a very strong influence to downregulate the inflammatory system inside of our body, help take somebody with increasingly high levels of inflammatory cytokines and bring those down, while also building back up the anti-inflammatory system that we all inherently have. It also helps to balance the different arms of the immune system, improving our ability to fight infection while reducing that inflammatory load. We also know that as we drive more oxygen into the body, we can upregulate mitochondrial function, which is a hallmark of autism spectrum. We also know that we can drive more blood flow into the body, helping get more oxygen to the mitochondria. The mitochondria is the part of the cell that needs to make cellular energy, and we need cellular energy to perform normal activities, but also to heal, to recover, and to regenerate. So upregulating mitochondrial function in these kids is critically important, and oxygen is the main rate-limiting step to that type of performance. We also know that if children have mitochondrial dysfunction, we can improve that efficiency, but we could also make the mitochondria bigger, and we could also increase how many mitochondria they have in their cells. So if we're trying to get more cellular energy and the mitochondria grow and replicate, the amount of cellular energy that we can encourage the body to create becomes exponential after a series of hyperbaric exposures. We know that if there's areas of the brain that are hypoperfused, even inside their first session, we're going to improve oxygen and blood flow going to those areas of the brain. By actually increasing new capillary growth in those areas, when we stop hyperbaric, that area of the brain will now be able to oxygenate on its own. By stimulating central nervous system stem cells, we can actually improve neuroplasticity and brain healing as a result of these hyperbaric exposures. There are so many different strategies and therapies to consider when trying to help somebody with a chronic illness, especially something as complex as autism spectrum. Inside that concept of different strategies and therapies, Some are very targeted, and some are going to be more systemic. In my opinion, any time that we can apply a singular therapy that inside is going to have a multi-therapeutic impact on its own, that's a huge win. Imagine one therapy alone that's bringing inflammation down, helping our body fight infection, reducing inflammation in the brain while improving oxygenation to the brain, helping to improve brain development and neuroplasticity. Often the results of which become a child that is calmer, more able to have motor planning, improved communication, both in terms of accepting instructions, but as well as verbalizing responses. A child that's making eye contact and having healthier interactions with their peers, their teachers, and of course, inside their family. And honestly, inside of our office, having the chance to work with so many families with children affected with autism, we've seen all of those changes. Maybe one of the most impactful changes that I've had a chance to see dozens and dozens of times, having a nonverbal child climb out of the chamber and speak their first words to their mother or father. There might not be anything more rewarding than that. It still blows my mind that a therapy that's so incredibly safe, all we're delivering is a change in pressure and a shift in their oxygen levels, something that everybody experiences at different times throughout a day, week, month, and year on planet Earth, has such an incredibly large impact on these children's health. I'm surprised after all these years and all of these successes that hyperbaric is still not considered a frontline therapy for autism yet. We'll get right back to the video, but real quick, I wanted to let you know that if you're new to hyperbaric and you're really trying to learn more about hyperbaric oxygen and its appropriate uses, I wrote a book, Oxygen Under Pressure, which is available on Amazon, and it goes into the details of what is hyperbaric, how does it work, why is it so powerful for so many of the things that it helps, and how do we use it appropriately and use it safely. And so if you're interested in that, we're gonna add a link in the description below so that you can buy that book today. All right, now back to the video. From a protocol standpoint, in most cases, you don't need to go to incredibly high pressures with these children. For the most part, we're really trying to impact the inflammation in the brain, both of which show best results at more mild pressures between 1.3 and 1.5 atmospheres, usually on enriched oxygen. The most important part of a protocol for almost all chronic conditions is the frequency. As a result, 4 to 6 sessions a week for 8 to 10 weeks is pretty standard, being the first protocol that a child might go through. We're typically trying to get to around 40 hours of treatment as the initial program. For most kids, there's a delay between the time that they start hyperbaric and the time that the parents start to see some changes. In fact, that's true for almost everything that we use hyperbaric for. As the sessions continue to accumulate, we start to see some of the changes that we're looking for. And typically from hours 15 or 20 up and through sessions 30 and 40, we start to see exponential improvements in that child's health. In some cases, we do one 40-hour program, and that's all the child needs. In other cases, we do that 40-hour program, we take some time off, and then over the next few months and years, we put together smaller clusters of sessions, depending on what that child needs in order to continue to recover. When a family first comes to us, they often have a list of, here are the things I hope to see as a result of doing these treatments, and this is the order that I hope to see them in. Hyperbaric is a therapy that's being delivered systemically. We're in a chamber, we're changing the pressure, we're adding oxygen, the body's taking this oxygen in, and the body's using it to heal. I can't always promise a parent, well, yes, these are exactly the things you're gonna see, and I certainly can't predict that these are the order you're gonna see them in. What I can say after all these years of treating children on the spectrum is that we've never put a child in the chamber and had nothing happen. Oxygen is so incredibly critical as an ingredient in the healing and recovery process that by delivering this high surplus of oxygen over a period of time, things will change, things will heal. But in which order, I can't predict. And how far can we take it? I'm not sure. But we've essentially almost always seen improvements in every child that we've had the opportunity to work with. Hyperbaric is definitely a financial commitment and a time commitment. But for those families that have chosen hyperbaric as part of their treatment protocol, I have not seen a family regret making that decision. I hope this video helps you better understand the use of hyperbaric oxygen as it relates to autism spectrum. I hope it's answered many, if not all, of your questions. If you're looking for hyperbaric as part of your solution, I have to also recommend that you look for a clinic that's been applying hyperbarics for pediatrics and specifically for kids diagnosed on the spectrum. You certainly want to be in an office environment that's taken the time to be conducive for you and your family. You also want to make sure that that office has been trained and certified in the application of hyperbarics for pediatric conditions, especially neurodevelopmental delays, all of which will help ensure that you and your family have a great experience as well as get the results that you're hoping for. Thank you so much for your time and attention, and I'll see you on the next video.